Hey, this is Chloe, and today I'm going to show you how to prime primary IV tubing. So before anything, you want to make sure that you do the 3 checks and 5 writes of any medication with your solution. You want to check the expiration date on the bag, and you also want to make sure that the patient name matches the patient that you're going to give it to. Then you want to put a sticky note or some type of note on the bag that states the date, the time, your initials, the rate of infusion and drip factor, and the start time of the infusion and the end time of the infusion. So once you've done all of that, you're ready to actually prime your tubing and get your tubing ready. I have my tubing over here, and I made sure it's not tangled up or anything. So it's not tangled. And I make sure that the clamp is closed before anything. And I'm going to take this protective cover off of the saline bag. And make sure that I keep that part sterile and I don't really touch it. So I'm going to leave this in here for now. So I'm going to take my spike and make sure that I don't contaminate it, because this part is sterile and it's going to go into the solution that goes into the patient. So anything that gets on there could go into the patient. So you want to spike the bag without touching the actual spike part. And you want to make sure that you twist it in there nice and tight. So your spike is in there and it's not contaminated. And so you make sure that your clamps are still closed, which they are. And you can go ahead and flip over your bag and hang it on your pole, or my dad is going to hold it. So then, with this part, this is the part that goes into the actual IV. So you want to make sure that this remains sterile as well. So you will screw off this cap and not touch this part. You will wipe it with an alcohol wipe and hold it to where it can drain into a container or some type of drain. And then you're ready to prime the tubing. So you open the clamp very slowly. Make sure it's not tangled or has any kinks in it. Okay. And then you open the clamps. Well, first you gotta squeeze in your liquid about halfway. Probably be important to do. And then you're ready to open your tubing. So you open it slowly and watch it come through. Once it gets to the end, you can kind of slow it down a little bit because you don't want to lose a lot of fluid, because this is your patient's medication. So it gets to the end and you let a little bit drip out, just so that way you can know that it's primed. You check the tubing for any air bubbles, and if they're in there, you can flick it or maybe let out a little bit more tubing. So that is how you prime IV tubing.